A bladder infection, better known as cystitis, or an inflammation of the bladder, is quite common among women. Over 50% of all women will experience such an infection in some form within their life. While common, they can lead to worse problems if left unchecked, sometimes necessitating bladder suspension surgery. Here are 5 facts about bladder infections you may not have known. 1. Is a bladder infection serious? Usually, if an infection is treated right away, no serious illness or after effects will occur. However, some women are more prone to them, and cases may recur or even become chronic. Though it is rare, this can sometimes result in the infection traveling to the kidneys, which can be far more serious, even resulting in permanent organ damage. For this reason, it is critical that any infections be examined and diagnosed by your doctor, and the underlying causes properly treated to prevent the infection from coming back. 2. What causes the infection? The majority of cases are caused by various strains of E. coli, bacteria that lives in the stomach and intestines. Some infections of the bladder can also occur after sexual intercourse. Vaginal intercourse makes the process of bacteria getting to the bladder through the urethra much easier. Pregnant women may also be at a greater risk because their urinary tracts change in response to hormones and kidney function. Spermicides have also been known to increase the risk of an infection. 3. How do I know if I have an infection? An infection of the bladder can range from painful to mildly uncomfortable, but usually clears up quickly and are typically harmless if treated properly. The most common and likely signal is a burning sensation during urination or a physical urge to urinate, even if you have already gone or know your bladder is empty. If your urine is cloudy, bloody, smelly, or in small amounts, it could also indicate an infection. Bladder spasms, lethargy, and fever or chills are also symptoms that the infection has gotten worse and possibly is spreading to the kidneys. 4. Do men get bladder infections? Men very rarely experience infections in the bladder, and doctors are not exactly sure why men tend to be more resilient to infections in this area, though they often cite the fact that a woman's urethra, a tube that carries urine out of the bladder, is only 1.5 inches long, far shorter than men's. Since this tube is shorter, bacteria have a much easier time finding their way to the bladder. While men rarely experience cystitis, reported cases increases as they age due to the enlargement of the prostate over time. When men do develop infections in the bladder, it is often a cause for concern, as it may be a sign of an underlying issue, such as a protrusion or obstruction causing pressure on the urinary tract. 5. What is the treatment for an infection? Typically, your doctor will prescribe an antibiotic to kill off any offending bacteria. However, if your case is very serious, your treatment may be more involved. When infections are left unchecked or spread to the kidneys, it can sometimes result in kidney damage or urinary incontinence. In the bladder case, bladder suspension surgery may be prescribed to allow your bladder to function better.